Munchausen syndrome. In this syndrome, a person repeatedly and deliberately acts as if they have a physical or mental illness, when in reality, they are not sick. People with this condition make up or exaggerate illnesses, seeking endless tests, procedures, and hospital stays, seeking the attention sick people usually receive. This often involves obsessive research on medical conditions and procedures, leading to anxiety and distress when their fabricated illness is questioned. Oppositional defiant disorder. It is mostly diagnosed in children. Children with oppositional defiant disorder show a pattern of uncooperative, defiant, and hostile behavior toward friends, parents, teachers, and other authority figures. They are more troubling to others than they are to themselves. A parent may ask a child to clean their room, and instead of simply saying okay, there's an instant response, a rude look, and maybe even some stomping of feet. It's not just about being difficult, it's a response that feels almost automatic. It's olfactory reference syndrome. It is when people have a fixed belief that they emit a foul odor despite no evidence. This belief leads to obsessive worry and distress, causing them to engage in repetitive behaviors like excessive showering or social avoidance. Individuals may constantly check themselves for any sign of odor, repeatedly shower or change clothes, and excessively use perfumes or deodorant in an attempt to mask the perceived smell. Frigoli delusion. It is when a person holds the delusional belief that different people are a single person who changes appearance or is in disguise. People who have this delusion believe that everyone they see is just one person posing as others. For example, they may think a stranger is a friend of theirs in disguise, or that various people they encounter are the same person transforming their look. Those trichotillomania. It involves frequent, repeated, and irresistible urges to pull out hair from the scalp, eyebrows, or other areas of the body. People with this disorder may try to resist the urges but can't stop them. Hair removal becomes excessive, leading to noticeable bald patches on the scalp or eyebrows. The urge and resulting hair pulling can happen during times of both stress and boredom. Erotomania. It is a form of delusional disorder where an individual has an unfounded belief that another person, often a public figure or someone of higher status, is deeply in love with them, despite little or no evidence to support this belief. Dissociative amnesia. It isn't about simply forgetting things, it involves experiencing gaps in memory, like missing pieces of a puzzle from your life. People with dissociative amnesia experience an inability to recall important personal information, often related to traumatic or stressful events. Sudden and unexpected memory loss can involve forgetting specific events, periods, or even personal details like their identity. Possible causes are usually severe emotional trauma, as the mind may unconsciously block out traumatic memories as a way to cope with overwhelming emotional pain. Dermatillomania. It's an irresistible urge to pick at the skin, whether it's a blemish, a scab, or an imperfection, despite knowing that it will lead to damage and potential scarring. Skin picking is done in response to negative emotions, stress, or boredom, and can provide a temporary sense of relief or satisfaction. Attempts to stop picking are usually unsuccessful, with the cycle of picking and healing leading to physical discomfort, skin infections, and long-term scarring, further fueling feelings of distress and shame. Cotard syndrome. With Cotard syndrome, you'd often experience severe depression with delusions. The main delusion is an extreme belief that they or parts of their body are dead, rotting away, or do not exist. Some people think they have lost their soul or vital essence. They may try to throw out their possessions, stop eating and drinking, or even try to disprove their existence by injuring themselves without pain. Some feel immortal, while others lose interest in and withdraw from loved ones because they no longer believe they or their family is real. Bulimia nervosa. Victims often experience episodes of binge eating during which they consume large quantities of food in a short period, feeling a loss of control over their eating behavior. Following a binge, they feel intense guilt, shame, and disgust about their eating habits and body shape. To cope with these feelings and the fear of weight gain, individuals with bulimia engage in purging behavior such as making themselves vomit, misusing laxatives, or excessive exercise. It's a disorder that consumes thoughts, emotions, and relationships, leaving individuals feeling isolated, ashamed, and overwhelmed.